post that question in the chat. So we are recording and it will be posted later today on the foundation's website at www.hfsf.org. And then we will also ask that if you can, please include your name and the organization that you're affiliated with so that we can know who's here. We're so thrilled and excited. We had over 170 registrations for the webinar, which is really exciting to see the response and the interest, as Sandra alluded to this notice of funding opportunity. And lastly, I am Dr. Janisse Schoepp. I'm the Vice President of Strategy at the Health Foundation of South Florida, and I will be facilitating the first portion of this webinar, and then I will be joined by our partners from Health Management Associates, which I will be introducing in a bit. Next slide. So today's agenda, we'll briefly go over the Health Foundation's vision and mission, and the reason for that is that we have a new strategic framework at the foundation, which we are executing and operationalizing this year. And we'll go over the particulars of the notice of funding opportunity, which is the opportunity to advance one of our strategic goals, which is around social needs and clinical care delivery integration. And then we'll go over some immediate next steps. So in terms of the foundation, for those of you that may not be familiar with the Health Foundation of South Florida, we have always said we're a grant-making organization, but I think we have shifted a bit in thinking about the foundation as really an investor for health. And we aim to be a catalytic agent for change and innovation to address the health disparities that we have observed for too long, both at the individual level and at the community level. But helping us understand that we must address the non-medical factors that we all know impact 80% of health outcomes in the first place. Since the foundation's inception in 1993, we have invested over $140 million in support of organizations and efforts to advance health equity. And many of you here today in this webinar have been partners advancing the impact of the foundation. Our mission, vision, and long-term goal, as I said, has shifted over the last couple of years. And we are now moving to be more explicit around the need to address the social and the economic factors that people live in, work, pray, play, so that we can have better health outcomes. Next slide. So here's our vision, mission, and long-term impact. Our vision is that everyone in South Florida has an equal opportunity to achieve optimal health and well-being. Our mission, as I said, is that we want to be an investor and be a catalytic agent. But there's three words here that are fairly new to the foundation. We recognize the importance of cross-sector collaboration. We recognize that while programs are important, that we must also seek to change policy and systems to improve the health in communities. And we're also more focused than ever on having an impact in low to moderate income populations and communities. At the end of the day, we're doing all of this because we want to reduce health disparities and advance health equity, which I know many of you in this webinar today share as a vision. But if there's anything to take from this slide, is the word collaboration, long-term, sustainable, and scalable change and impact. So we wanted to socialize with you our three strategic goals. The first goal is probably very familiar to you all because it's been at the core of the foundation since inception, and it's the goal of increasing access to healthcare. We want to ensure that we're increasing healthcare utilization, improving quality of the care being provided so that we can improve health outcomes. So this is probably the goal where we have partnered mostly. The second goal is a focus on reducing health disparities by taking a more holistic view at an individual. So that if an individual goes into a healthcare provider, they're assessed not only for their clinical needs, but also for their social economic needs. And this is what this Notice of Funding Opportunity is about. It's about advancing the integration and the collaboration and the partnership between these two sectors of healthcare and social services or human service organizations. And it's not only aligned with our strategic goal, this Notice of Funding Opportunity, but we're also being responsive for those of you that were able to attend the Black Hills Summit. It's being responsive and aligned with the priorities that were identified at the Black Hills Summit back in June. You will see later on that one of the areas of interest for us to make advancements and improvements in is Black maternal and infant health. So lastly, we know that while our first two goals are very focused still at the individual level, we must change the community conditions in which people live. And this is our thriving community goal. And we believe it is important that we have interventions at the community level that will help improve access to affordable quality housing and also help improve and increase economic mobility. And this is where our housing efforts and our South Florida Anchor Alliance efforts lie, which is focused on workforce development and building a small business ecosystem. So what are the specific goals of this particular Notice of Funding Opportunity? What are we trying to achieve? We are trying to cultivate and foster meaningful and impactful collaboration between the social and healthcare sectors. We believe collaboration is key, and we're trying to do this through what we're calling health equity collaboratives. The goal of these collaboratives is really to build, among many other things, to develop pilot implementation projects that will help build the infrastructure in order to support that coordination and collaboration. So just to give you a very quick example, it might mean that you need to be thinking about what data or technology solution might help or assist with increasing communication and coordination of care across the different providers, so that if an individual or a patient is being assessed for a particular social need and is being referred and linked to existing programs in the community, we're able to understand if that referral loop was closed, right? Did that individual get the services that they needed? And it also allows for the tracking of those patient outcomes. We need to generate data of the impact that we're having. And so we are wanting to have a solid evaluation framework around the pilot projects that we'll be supporting. Why is this important? Going back to what I said earlier, we want to create long-term sustainable change. So that with this funding, if we are able to catalyze and start interventions that work, how can we be thinking about the payment financing models that need to be in place to support that in the long term? We want to build sustainable and scalable models. And so this brings me to what an opportune moment we are in. We have the Centers for Medicare and Medicaid Services. We have accrediting bodies like the Joint Commission, and we have the Medicaid reprocurement process going on in Florida. And all of these entities and efforts and focus are all around how do we advance health equity. We are in an opportune moment to really begin to incentivize organizations, both healthcare and community-based organizations in the social service sector, incentivize them to keep people healthy. And so that leads me to the introduction of our technical assistance partner, Health Management Associates. We have engaged HMA as a technical assistance partner for this effort. And I will ask Kelli to join, who will be facilitating, along with some other team members from HMA that are joining us today, the rest of the webinar. But I will tell you, we brought HMA in because of their extensive experience and track record in things like value-based contracting, Medicaid, Medicare, thinking about how to build sustainable financial models to be able to support the work that we're talking about. And so we are excited at the Health Foundation that partners will be able to work alongside HMA and the foundation staff team to really have an impact in this community. Kelli Stannard is senior consultant at HMA, and she is a nurse and former public health professional in Florida who has extensive experience serving children and youth with special healthcare needs. She has worked with a number of programs to build and implement initiatives designed to improve health outcomes. And so I'm going to ask Kelli to join.
Thank you, Dr. Schoepp. I'm happy to be here with you all today to review this exciting funding opportunity, and we appreciate the partnership with Dr. Schoepp and the entire HFSF team. We value and align with the goals of HFSF, and we are honored to be a part of this initiative. Health Management Associates is an independent national research and consulting firm specializing in publicly funded healthcare and human services policy, programs, financing, and evaluation. HMA has a team of respected and proven experts from a variety of states that have successfully designed, implemented, and evaluated statewide and large-scale health equity efforts, which include strategies for sustainability. HMA will provide technical support to this initiative that is seeking to advance a system of health that integrates social needs and clinical care through deeper collaborations between healthcare providers, payers, and community-based organizations. On this slide, you'll see our core team that will be supporting this initiative. We have, along with myself, Beth Kidder, Kelsey Moore, Letitia Reyes-Nash, and Maddie Shea. With me today to help present are Maddie Shea and Kelsey Moore. Dr. Maddie Shea is a principal with HMA, and she has more than 30 years of experience in community health collective action and health equity-focused program design and evaluation. She consults with foundations, counties, states, health systems, and health plans on health equity strategy development, implementation, and evaluation. As the Centers for Medicare and Medicaid Services Office of Minority Health Deputy Director, she developed, implemented, and evaluated CMS equity frameworks, policies, and innovations, and consulted on the design of new models addressing social health determinants and the equity impacts of delivery system transformation. We also have Kelsey Moore with me. She is a research associate with HMA, and she is a skilled researcher and has strong background in project coordination and has experience in developing and implementing programs in the justice, mental health, and public health spaces. So the purpose of this information webinar today is to provide you all with an opportunity to submit questions and just hear a little bit more about the actual required components of the notice of funding opportunity. And then we'll close with outlining some important dates for you all and reviewing some milestones. So on this slide, you'll see the email address that you guys can begin submitting questions to right away at the conclusion of this information webinar. We will also place it in the chat so that you can have a direct link to it, and we'll show it again to you later on. Now I'm going to pass this over to Maddie, who will provide us with information about the requirements for this opportunity.
Thank you, Kelly. So what's required? We start with the who. Applicants with at least one healthcare organization or payer and at least one community-based public health or social service organization. So in other words, a single organization would not be responsive to what this NOFO is asking for. What? We're seeking proposals from multi-sectoral partners that clearly demonstrate an identified population and/or health condition focus, so an outcome you want to achieve, understanding of evidence-based approaches and plans, commitment to equitable engagement processes and plans, among your partners, technology-enabled solutions, and plans for sustainability. Eligibility and criteria. So who's eligible? Safety net providers, for example, federally qualified health centers, hospitals, community-based clinics, health payers, community-based organizations, working collaboratively to help transform the South Florida health delivery system, specifically in Broward, Miami-Dade, and/or Monroe counties. For fiscal management, we would expect that one organization with the collaborative may serve as the fiscal agent to partners and must provide prompt and timely payment to partners. How to apply: you will submit an application to the NOFO using the Google form on the Health Foundation of South Florida website. After reviewing applications, foundation staff will notify selected applicants. So the areas of focus and interest, as Janisse started out with at the beginning of this presentation, is Black maternal and infant health, healthcare access barriers, chronic disease disparities, or we're open to other areas as long as they're substantiated by the data and appropriate for collective action, you know, a health equity focused collaborative. So the important deadlines and meetings. So you know that this has been posted. The question submission deadline will be November 3rd, 2022. The applications will be due by noon Eastern Standard Time on November 18th. You will get notices of award on December 1st, obviously 2022, on December 1st. And you would need to be planning for mandatory required participation in workshops on the following dates: virtual December 9th, in person January 13th. And these will be either a little less than half a day or in person a little bit more than half a day, just so you're aware. In person would be January 13th next year, virtual February 10th, and in person March 2nd.
Thank you, Maddie. So on this slide, you'll see information regarding funding. The first round of funding will be for the planning phase. Grants will be for $17,500 for each health equity collaborative. For the planning phase, HMA will provide the training and technical assistance to assist collaboratives in developing community-informed, outcome-based implementation plans. Technical assistance may also include guidance on how to connect this work to health equity accreditation and quality initiatives in clinical settings. So for example, Joint Commission Health Equity Accreditation, NCQA Health Equity Accreditation, and patient satisfaction surveys. The approach of the intentional planning and investment at the onset of these initiatives will be necessary to support and develop projects that require multi-sector collaboration in order to address the complex issues. And then for those collaboratives that successfully complete the planning phase, there is a potential to receive an implementation grant, which may be a multi-year investment averaging $350,000 to $500,000. And then on the next slide, this highlights the milestones within the planning phase and breaks down the funding by each milestone achieved. Again, this approach is intentional to support teams through the planning phase, and each milestone builds on the activities from the previous milestone. You can see that each milestone requires leaders from each organization represented within the Health Equity Collaborative to participate in the workshops. Those were the dates that Maddie mentioned for us. It's really important for the success of these Health Equity Collaboratives because we know that leadership support and champions are critical to successful multi-sector and complex projects. Now I'll pass it over to Kelsey, who's going to review next steps with us.
Thank you, Kelly. And like we mentioned prior in the presentation, please submit your questions that you have today to my email, which is kelseymore@healthmanagement.com by November 3rd, 2022. You will have access to the recorded webinar and answers to your submitted questions at the HFSF website. with the link included in this presentation, which will be distributed as well. And you will receive a notification email when answers are posted to the website. And for additional assistance, please contact the Health Foundation at the number posted here, which is 305-374-7200. And I'm going to pass it back to Janisse.
Thank you so much, Kelsey. And I want to thank everyone for joining us today. The information, I see some of the questions about the presentation today. It will be posted on the foundation website later today. But I do want to ask our president and CEO, Lorraine Chand, for remarks.
Thank you, Janisse. I appreciate that. And thank you to the team at HMA for helping the foundation to get to this moment. We have several board members of the foundation who are on the call today, and I want to thank them for their support and leadership as we are very excited to announce this funding opportunity to our partners in this community. As Janisse mentioned, many of you have been partnering with the foundation for quite a long time, and obviously our efforts in this funding opportunity is to bring more of our partners together in pursuit of health equity. I want to also remind you that all of this information will be posted on our website, www.hfs.org, and the team and I are really looking forward to supporting each of you as you work to build your collaboratives and come to the table to find solutions for reducing disparities in our community. So thank you all for being here. We look forward to hearing from you, and I can tell you that we're all very excited about where this project can lead us and our community. So thank you so much for that. I think that concludes our webinar today. We are all available. We will post the webinar and start responding to questions shortly. So thank you so much.